Aloha guys, this is Dr. Tom coming at you once again for more fascinating study. Today we're going to talk about the anatomy of blood vessels. So hang in there and don't panic. Okay, we're going to move fast on some of this. You'll have to go back over it on your own. Okay, veins bring blood back to the heart, arteries take it away from the heart. In between the veins and arteries are little tiny vessels called capillaries, and capillaries are where the real work takes place. That's where the gaseous exchange and so forth. And there are capillary beds all over the body. Okay, so arteries take blood away from the heart. They eventually contract down to little tiny ones, which are called arterioles. Capillaries, which I just mentioned, is where really all the work takes place. Because remember, they're only a single layer thick, guys. Or we may not have touched on that. In case we didn't, we'll say now they're only a single layer thick of epithelium. So it's very easy for things to diffuse through them. And then after the blood travels through the capillary beds, they're called, it returns to the heart by the veins. Little tiny veins are called venules. Veins are called veins. Okay, now guys, don't let this flip you out here too much. The inner lining of a blood vessel is called the endothelium, or tunica intima. The middle layer is tunica media, elastic tissue, and smooth muscle. Now, capillaries, of course, don't have this, but arteries particularly do, and to a lesser degree, veins. Smooth muscle because arteries can dilate and constrict on command. And then the outer portion, tunica adventitia, is connective tissue. Now, guys, I know this is all a little complicated, but it's basically saying this right here. Where does the work take place? In the capillary beds. In the capillary beds. This is just a repeat of the same thing. Single layer of endothelium or squamous epithelium allows this to nutrients and gases to diffuse easily. Okay, they call arteries conductance vessels, okay, because it's conducting the blood out. Arterioles resistance vessels, because they're getting smaller. Okay, and then by the time the blood gets to the capillary, guys, the blood pressure to it is down substantially. This is where the exchange takes place. Capacitance vessels are what they call veins and venules. Okay. Again, that's what returns it back to the heart. Okay. The big artery in the body is called the aorta. We have the ascending aorta that comes off the left ventricle, the aortic arch, and then the descending aorta that goes down posterior to the heart. Okay? We just touched on those. And then it extends down through here's the diaphragm, goes through the diaphragm, there's a hole there for it, comes down, and eventually bifurcates at the common iliacs and then goes into the legs and stuff. Off of the aortic arch. Well, let's wait a minute. We're going to touch on that in a moment. Also, too, from the ascending aortas are where the coronary arteries branch off of that are so important. Okay. And here it mentions that the ascending aorta has the right and left coronary arteries. Now, guys, don't let this fool you. They're just showing every picture has every artery in it. Don't worry about that. Okay, off the aortic arch, there's the brachiocephalic artery, or brachiocephalic trunk it's called. And then there's a left common carotid artery and a left subclavian. Now, what are the collarbones called? Clavicles. Why do you think it's called subclavian? Because it's under the clavicles. So there's a surprising lack of symmetry here, and I don't know why. Instead of having two right and left carotids and two subclavians coming off the arch, on the right side it has a brachiocephalic trunk that then gives rise to the carotid and the subclavian. On the left, it has the left common carotid and subclavian. Okay. So what are the three things that branch off the aortic arch? Right here, brachiocephalic, left common carotid, left subclavian. because the right common carotid and subclavian come off of it after it's already the brachiocephalic. Now, most of the places in the body and in nature has a wondrous symmetry. This is an example of something that's not. I'm not sure why. Okay, we already mentioned. Again, this is the same thing over and over again. We're just be interested, guys, in what they got highlighted here. The ascending aorta, the one going up, the right and left coronary arteries that feed the myocardium come off of it. And then the aortic arch, we just said, these three things. As the descending aorta goes down into the thoracic area, the intercostal arteries and other arteries come off of it. Okay, that's good enough for now. And then as it reaches the abdominal area, we have a branch called the celiac trunk that has three. The mesenteric arteries, the renal arteries going to guess where? The kidneys, and the common iliacs. When the abdominal aorta bifurcates, it changes into the right and left common iliac. Okay? So the abdominal area has what? The celiac trunk, the mesenteric arteries, the renal arteries, and then eventually it comes down and becomes the common iliacs. Hang in there with me. Again, they're showing every major artery in every picture, so I can see where that'd be flipping you out. Now, are you going to have to go back over this some? Well, yeah, unless you've got a photographic memory, I'd say so. Major arteries are the shoulders and upper extremities. Number one is the subclavian, bilaterally. Axillary means armpit, so guess what? As this artery passes through these various regions, guys, it takes on the name of the region it's in. So the subclavian passes through the armpit, bingo, it becomes the axillary artery. Goes down through the arm, it becomes the brachial artery. Brachial is the word for arm. It makes it bifurcates, or it splits out. Goes down the radial side, it becomes, guess what? Yes, the radial artery. If it goes down the medial portion, it becomes the ulnar artery. You can see it actually bifurcates. And then there's palmar loops and little loops that go to the fingers. And they leave it at arteries to the hand, and that's good enough for me. So, as these things travel, it does that in the legs too. It is named for the various regions that it travels through. Branches of the aorta, descending. Again, the intercostal and some other arteries, okay. The abdominal, the celiac trunk, has three arteries that branch off of it. The gastric artery goes to the stomach, as the name would suggest. The splenic artery goes to the spleen, as the name would suggest. And the hepatic artery goes to, of course, the liver. The mesenteric artery, superior portion, supplies small intestine, part of the large intestine. The inferior portion supplies the remaining large intestine. So there's a superior and inferior mesenteric artery. The mesentery is a fatty apron that hangs down and protects the abdominal contents. I know so far you don't know that name. The renal arteries go to the kidneys, and then the common iliacs. Okay, I think we're doing all right, guys. Major arteries of the lower extremities. External iliacs, remember it's a common iliac, and then it becomes the external iliac. As it goes through the thigh, it becomes the femoral artery, major artery in the body. As it passes down by the kneecap, it becomes, guess what? Or the posterior portion of the knee is the popliteal area. Then becomes the anterior and the posterior tibial arteries, just like the tibia bones there. And as it goes over top of the foot, it becomes the dorsalis pedis. Sometimes it's called dorsal pedis. This is given the Latin spelling. Okay. Now again, guys, I know you're going to have to go back over this. All right, now see, we're going to cover the head and stuff in a minute. We've already covered all the major arteries of the body. Aren't you proud? Don't you feel proud of yourself? You should. Now, major veins. Some of the veins are named the same as the arteries, some aren't. Now, we know there's two gigantic veins that empty into the right atrium, the superior vena cava and the inferior vena cava. There's the superior, and there's the inferior. Superior drains head, shoulders, upper extremities. Inferior vena cava drains all the regions below the diaphragm. The diaphragm is right in here. So inferior vena cava, superior vena cava. abbreviate SVC, IVC. Those are fairly common abbreviations. Okay, veins draining into the superior vena cava. The ulnar and radial vein, guess where they're at? In the arms. The basilic and cephalic veins. Cephalic means head, so they're up more. The brachial vein in the arm, of course. The axillary vein, of course, in the armpit. The subclavian vein, same near the subclavian artery. Brachiocephalic, very similar to what comes off the arteries that come off the aortic arch. Brachiocephalic. The jugular veins. The internal jugular veins, you may have heard of them. They're in the neck. Here it is here. The external and the internal. Internal jugular veins drain blood from the eye brain. Okay. Whereas the external jugular vein, the internals drain the brain, the external jugulars drain the face and neck. When it says drain, it means takes it back to the heart. Veins draining into the inferior vena cava, tibial, perineal. Some people pronounce that peroneal, down here. Popliteal, around the knee. Femoral and saphenous vein. Saphenous vein is the one they often cut out and make if they're doing heart bypass on people. They strip that vein out and chop it into pieces and reroute it in the heart. External iliacs go into the common iliac, just like the common iliac arteries, there's common iliac veins. There's renal veins, and there's the hepatic veins from the liver. Special circulations, blood supply the head and brain, blood supply the liver, fetal circulation. Okay, the carotid arteries are the big ones that carry blood up to the brain. But also the vertebral arteries do too. There are arteries bilaterally that thread through the transverse processes of the cervical vertebra. And then there's a famous circle of Willis back here. But in this picture, the carotid arteries, internal and external, this is called common, and then when it splits into internal and external, the right and left vertebral artery. The circle of Willis. Now this is looking at a posterior, an inferior view of the brain, looking up at it. Here's the circle of Willis. It's a real common place for strokes and other problems to occur. Okay, here's the aortic arch. Here's the brachiocephalic trunk. Common carotids go up. Here are the two vertebral arteries without the vertebra. Here's the left common carotid. And we have these massive blood vessels here that have great importance. Here's the brainstem. See a lot of blood there. Vertebral artery, basilar artery. Okay, here's the actual circle of Willis, as it's called. Very important area. Okay, venous drainage of the head and the brain. Well, the external and internal jugular veins handle most of that. There are also vertebral veins, and there are also subclavian veins, similar to the arteries. Okay, after the food we've eaten has been processed and digested absorbed. Well, yeah, it's been digested too. Absorbed into the small intestine. It follows what's called the hepatic portal system and goes straight to the liver for processing. It doesn't flow around through the body with all that food and junk in it, or good stuff. It's not necessarily junk. I don't mean it literally. And that's called the hepatic portal system. So the portal vein carries unoxygenated blood from the organs of digestion, primarily the small intestine, directly up. Here it is here. And it's called the hepatic portal system. They don't use that in this picture, and then there's also a hepatic vein that just carries the blood that nourishes the liver up to the inferior vena cava. And there's a major artery going to the vein that comes off the abdominal aorta. This portal system there's actually two in the body. There's one in the pituitary gland, and there's this hepatic portal. What's it do? It carries nutrient-filled blood directly to the liver for processing. Okay, we're about to run out of time. When we come back, we will pick up where we left off. We'll see you then. Dr. Tom, signing off.